Good.
Hey everybody, Dr. Doug, Bodyworks Physical Therapy for this week's virtual office. This week we're going to talk about low back pain. I've had a bunch of low back pain evals. I had 4 new evals on Monday, and they were all a different form of low back pain / hip pain. So I thought, I'm just going to do some talk on that. And the patients that had come in, they were all business people, active people that are doing triathlons or just sitting too much, or who are professionals, and we're seeing a lot in that realm. So remember the time when you could get up out of a chair and not hurt? Could you imagine rolling over in bed and not having your back hurt? Could you imagine getting onto the floor and being able to get by yourself, not having help? Well, that's what we do here at Bodyworks, is we help people do what they want to do without pain pills, get back to what they love to do. So I want to explain a few things that I'm seeing with back issues. Here's a model of a back, and I see a lot of people that have back trouble right here. I bet you guys are maybe a bit like me, that sometimes when you sit for too long, you drive for too long, you get up out of a chair, and you get out and you go, oh, you're stiff, and you take 10 or 20 steps and it kind of loosens up. You ever done that? I think we've all done that. Well, a lot of that is coming in, the issue is coming in from right here, the sacroiliac joint, but it has a lot of influencers that affect that. Several different things we see. One is the hip joint we're finding, and finding in the research. If you don't have good hip joint motion in a couple different directions, the hip gets tight, it locks up, and then it starts to have motion happen in that SI joint. That moves a little bit, and then you start having irritation in the low back. So we see that contribute to it. Another thing is we see flank pain. We see people that have this flank pain. You know, imagine being able to do yard work and not having your back hurt all the time. You get this deep flank pain. That's coming from a muscle called your quadratus lumborum. And when that thing gets tight, it pulls your SI, it pulls your hip up, it irritates the SI joint, okay? The other thing is that I see is there's a muscle around deep here. It's just trunk strength. We don't have good trunk strength. And when we don't have good trunk strength around here, our whole body just squishes together. And when we have good trunk strength, when the muscles engage, it gives us lift and it unloads all the joints, including the low back and the SI joint. So Cody and I have several different resources, and we've learned lots of techniques over the last 27 years of how to evaluate it, where the root of the problem is coming from. And one of the books we use is from Dr. Janet Travell. She's a former physician of 2 presidents. She's figured some things out. We use a lot of stuff from her in our treatment ideas, and we've seen some really good results. I just saw a guy this morning. He's a nurse. He hurt his back 6 weeks ago. It didn't really get better. I saw him one time last week, and guess what he had going on? He had this going on right here. We worked on this, got him going on some strengthening things. He come in this morning. I said, how you doing? He goes, 95% better. He goes, exercise is working great. I'm not having liquor problems. And so that's what we like to see here. We see a lot of progress with that. So if you guys have any back issues, if you know anybody that has any back issues, forward them this video, okay? Because this is what kind of we specialize in, and we hope to give people answers and get people going back to what they want to do without pain and pain pills. So have a great day for Bodyworks Physical Therapy.